Good evening and welcome to our COVID-19 update at this hour. I'm Ladi Akere-Doluale. Here are the highlights. Federal government unveils pre-departure protocols for international flights ahead of Saturday's reopening. PCR test is mandatory. Education authorities ask students to exercise patience and avoid violence, say schools will reopen eventually. And in Hong Kong, 4.5 months after his first infection, young patient tests positive again for a different strain of COVID-19. We will get to those pre-departure protocols for international flights in just a moment. But let's begin with the Minister of State Education, Mr. EMEKA, NWAJUBA, who has said the federal government is committed to ensuring that all Nigerian students are not left behind during this period. Speaking today during the Presidential Task Force on COVID-19 briefing in Abuja, Mr. NWAJUBA urged the students to be patient as efforts are being made towards safe reopening of all schools.
We don't want to bandy around dates, but we remain positive. And the sooner we can get that, the better. So I urge our students who have actually exercised a lot of patience along with their parents, because I know even my own children, they are beginning to think they've had enough of me. I understand that. And so it's like that in many homes. So really, I urge you to just bear with us a little bit more. The riotings need to stop. There's nothing to riot about. We're in full negotiations with ASU. They are fully engaged with this. And every player is engaged, because this idea also dovetails into the issue of when other strata of our education network can resume. Whether they be primary, our pupils, what they're going to be doing, or students that we have as post-basic. When they do, yes, some private institutions have done a little better than others. Some have actually done better than public schools. Well, there are also public schools that have done well. The curriculum is available for everybody. And we will measure those who have met it at where they are and some of the gaps, so that the states can advise those who run the primary sector and advise on what really needs to be done in order to harmonize. There will never be a one-size-fits-all around Nigeria, and I don't suppose we are trying to do that. What we're going to try to do is provide this guidance over how all of us work together. Already some things are already ahead of us. We had already concluded JAMB. So we may not necessarily be in a position to say everybody who scored JAMB this year will not go because we are waiting for some automatic provision. No. There's a holistic content around this, because many of all our schools had already completed their second term classes already. So third term is actually just what is in view. And the normal number of weeks and class time, 40 minutes class belts for teachers and their pupils, versus classes that are required for conclusion of particular subject classes, be they biology, methodologies, and so on and so forth. All of that will be put into context and see which of them the syllables of the next classes can carry, while the teachers migrate those who can.
The Lagos State Commissioner for Health, Professor Akin Abayomi, is responding well to treatment after testing positive for COVID-19. Professor Abayomi, who earlier confirmed his status via tweet from his official Twitter handle, says he will continue to discharge his duties as the Deputy Incident Commander for COVID-19 response in Lagos State. This is coming after several months of battling to save lives and prevent infections in Nigeria's epicenter of COVID-19, accounting for over 30% of the total confirmed cases in the country. Another statement from the Commissioner for Information and Strategy, Mr. Gbenga Omotosho, says Professor Abayomi became aware of his status following the required testing protocol of contact tracing procedures. He is asymptomatic and will be cared for in line with the Lagos-based, home-based protocol. if the concerns by the government over the spread of COVID-19 in the country is anything to go by, then the government may have to re-strategize ways to reduce the rising daily increase in reported cases of COVID-19. A roving report by our correspondent Gimba Omar today revealed that many people have totally neglected the COVID-19 protocols of wearing of face masks and maintaining social distancing in the wake of the extension of the East lockdown. While some people believe the virus is still out there, there are others who don't.
The morning traffic on entry into Lagos begins what can hardly pass as compliance to the gradual easing of the lockdown of the COVID-19 pandemic. Many motorists are defiant of the order. It's chaos for sure, as many more at the nodal area went about their businesses, as though there is no measure in place against the virus. Motorbikes that ought to have been banned here move freely in total disregard of the protocol. Driving further into the city, we spotted this gathering at a second-generation bank. There was no social distancing. The guards accosted us and threatened to destroy our camera. But the customers wouldn't have it, insisting the unfair treatment meted out on them at this branch must be exposed.
With the problem we are facing in this country, you are attacking him. Who are you? Because no one will show his picture.
In contrast, at another second-generation bank branch, orderliness is the hallmark.
Where this is going, they are complying over it to follow the rule and regulation of the COVID-19, so that it may not affect many people because of the cover note when they are doing it.
If you do not have your face mask, I don't think that you can go to the bank to do anything, because the bank will not allow you to go in.
Other businesses opened early on Monday as well, many of them in denial of what the pandemic portends. On the streets, the story is the same. Fear of the virus seems to have faded, despite an extension of the gradual easing of the lockdown.
It's a risk to me, Sha.
Do you believe there is still COVID-19 out there?
I believe.
Everybody is living the normal life as if there was no COVID-19 at all. So I just feel there shouldn't be need of it anymore.
A stream of yellow buses picked and dropped passengers at Agidingbe, oftentimes sandwiched, 4 in a row, spelling how difficult it will be to stop the spread of the coronavirus.
Less than a handful of people at that particular bus stop are wearing their face masks. That gives you a picture of what's to come. Gimba Umar, Channels Television News.
Nigeria will henceforth subject all pre-boarding PCR tests conducted on intending travelers into the country to further validation, as a high percentage of recent evacuees from abroad have tested positive for COVID-19. Speaking at the bi-weekly briefing by the Presidential Task Force on COVID-19 in Abuja, the Secretary to the Government of the Federation and Chairman of the Task Force, Post Mustafa, says over 60% of the weekend spike in the number of confirmed cases in Lagos State are evacuees who came into Nigeria. According to him, the decision to subject the PCR test results to further validation becomes imperative in order to prevent a further surge in the number of cases as the country prepares to open its airspace for international flights.
Saturday, August the 29th, is a set date announced by the Presidential Task Force on COVID-19 to reopen the airspace for international flights. However, the recent number of cases reported among evacuees who came from abroad is now a source of concern for the task force, as the date for reopening of Nigeria's airspace for international flights gets closer.
Out of the confirmed cases in Lagos on Saturday, 28th, that stood at 404 of those cases. 64% of that infection came from all manners of evacuees and the people who were returning from other countries for the purposes of going back to their places of work. That is a major source of concern that the Presidential Task Force will be looking at critically We shall intensify the validation process for the PCR tests to minimize risk.
The national coordinator of the task force also highlights some of the protocols that will guide international flight operations.
We will continue with the policy of ensuring that airlines only board passengers without symptoms of COVID and with negative PCR results. Airlines will be fined $3,500 per passenger if they fail to comply with pre-boarding COVID requirements.
Meanwhile, the increasing rate of infection among health workers, as well as the country's rising fatality rate, is now a major reason for concern.
Our ability as health professionals to maintain high index of suspicion for COVID or any other infectious disease will go a long way to enhance the response and to ensure that there is no further transmission of the virus to the health worker or other patients.
I commence this briefing on a sad note, as Nigeria has crossed the figure of 1,000 in respect of deaths arising from COVID-19 pandemic. We shall therefore continue to review and strive for improvement in the treatment of COVID-19.
Nigeria has recorded over 52,000 COVID-19 cases from the 379,542 tests conducted in the last 6 months. While the country has successfully managed and discharged over 38,900 patients, it has also recorded over 1,000 deaths from the virus.
The Nigeria Center for Disease Control, the NCDC, has been explaining that the weekend spike in confirmed COVID-19 cases in Lagos could have been caused by a backlog of collected samples and the status of the tested persons. The COVID-19 incident manager of the National Emergency Operations Center, who made this observation, also pointed out that the testing capacity of the state has increased considerably. On Saturday, August the 22nd, Lagos confirmed 404 new COVID-19 cases for the first time, the highest figure so far.
This outbreak is still rather dynamic, and it's also dependent on number of samples collected. So samples are collected on a daily basis, and when the results come out, that is when it's announced, because we want to keep Nigerians abreast of the information available. So we don't want to keep it, and it's also possible that some of the results that came out were not all test samples collected on the same day, but it could have been 1 or 2 days that were now batched and the results came out. So there'll be fluctuations, and what we now try to do is try to look at the data on a weekly basis to see whether there are variations. Then the other key thing is about testing. People are beginning to believe that COVID-19 is real. Testing is also increasing. Testing capacity in Lagos is actually very high. Lagos State can test about 2,000 cases in a day, more than 2,000 cases in a day. So with that kind of capacity, it should not be unexpected if you have once in a while a high number of cases based on the persons tested. If the persons are contacts, or if the person also had symptoms, they most likely may have a high case. And mind you, Lagos is a big city, so there'll be some fluctuations in the number of cases that we have.
Meanwhile, as the COVID-19 numbers spike in other countries, including in Europe, most members of the European Union have placed restrictions on travelers within and outside the region, and Nigeria is indeed affected. But as the country gears up to open international borders come August the 29th with plans for flight reciprocity for countries who are allowing Nigerians into their borders, our next report looks at the basis of international flight operations, often referred to as bilateral air services agreements. Our aviation correspondent, Bukola Joe Ketumbi, reports.
International flights are operated based on bilateral air service agreements called BASs. These are treaties signed between two countries to allow international commercial air transport services. BASs are negotiated based on the 5 freedoms prescribed under the International Air Transport Agreement. and they include the privilege to fly across a state's territory without landing, the privilege to land for non-traffic purposes, for refueling, repairs, and maintenance, the privilege of an airline from one country to carry traffic from its own country to another country, the privilege of an airline from one country to carry traffic from another country to its own country, and the privilege of an airline from one country to carry traffic between two other countries, provided that the flight originates and terminates in its own country. While countries across the world still maintain these agreements, the COVID-19 pandemic appears to be changing the status quo. Most countries in the European Union began loosening coronavirus travel and entry restrictions in June and July, but now several are imposing them back, even among themselves and other continents. As Nigeria prepares to reopen its international air borders on August 29, the federal government says reciprocity of entry will be applied.
They have placed ban on Nigerians and residents of Nigeria going to their country. So, in this process, we're doing determining who will be allowed to fly to Nigeria. The principle of reciprocity will be applied.
COVID-19 tests of not more than 7 days will also be required for incoming passengers.
All intending travelers to Nigeria must have tested negative for COVID-19 PCR before allowed entry into the country. We are narrowing the period of validity for the PCR test from the current 14 days to 7 days.
Many Nigerians are still waiting to see the countries that will be given access into Nigeria's airspace when flights resume. Bukola Joe Oketumbi, Channels Television News.
What's our situation report with regards to COVID-19 as of today? 1,002 people have died from COVID-19 in Nigeria, a grim reminder of the danger posed by the virus. Total confirmed cases also continue to rise, according to latest figures from the NCDC, with 322 new cases across 17 states and the FCT. The nation has now recorded 52,227 COVID-19 cases, 38,945 discharges, while 12,280 cases are said to remain active. Here's a breakdown of the latest cases. Lagos has 130 of those cases, Bauchi 36, the FCT 25, Edo 17, Bayelsa, Ogun, and Oyo 14, Anambra 13, Kaduna 12, Ondo 11, Abia 10, Osun 6, Plateau and Kwara 5, Kano 4, Ebonyi 3, Sokoto 2, and Borno 1. We'll take a break at this point. When we come back, we'll expand, take a look at what the issues are surrounding the issue of reciprocity in international aviation and what that could portend for the health of the domestic market. Please stay on with us. Welcome back to our COVID-19 update. Thanks for staying tuned. Let's discuss now with aviation consultant, Mr. Larry Bamboshe, who joins us via Skype. Good evening, Mr. Bamboshe. Thank you for your time this evening.
Good evening, Ladi. How are you today?
Fine indeed, and trust that you are keeping safe.
Indeed. Thank you very much.
Let's start with the issue of reciprocity. There was a lot of anticipation about the names of countries and airlines that would not be allowed to fly into the country. We were promised that list today at the press briefing, but somehow that didn't happen. That didn't come as a surprise to you, did it?
No, it didn't.
Can you tell me why?
Well, when we talk about reciprocity, I think I really must salute the Honorable Minister, Senator Adeswika, for wanting to pursue this line. But we also shouldn't lose sight of the fact that it may be coming to us as a catch-22 situation. Because if you look at it, really, when you look at the bilateral air services agreement that Nigeria had signed over the past few years, how many have we really actively serviced? So that, in the first instance, put us in a situation where we know so far we have not really showed capacity to match up to whatever comes out of either the UK, Germany, the United States, and the rest of them. So when we talk about reciprocity, we really must have that capacity to be able to match whatever the BASA says. Because when I heard the minister mention this and a few other industry professionals, the question I ask myself is this: are we talking about airlines or are we talking about nationals? If we're talking about airlines, then you look at it more from the point of view of BASA. We have BASA with several countries. How many of them have we successfully operated to? My knowledge of history, of late history, is perhaps only Arica in the past few years and Airpeace lately that have struggled very hard to service our BASAs. And these airlines, as you know, they have their own issues as well that they're struggling with. However, if you put that on the side now, and you put it, you now look at the issues of nationalities, except you want to tell me, or anybody wants to tell us that Nigerians will not be allowed into Germany, Nigerians will not be allowed into the United States, or they will not be allowed into the UK. That is when this reciprocity factor will matter. Because if you say Nigerians can't come into the UK, then we can tell the UK that we will not allow British citizens into Nigeria. And same thing will be applicable to other countries. However, if it's about airlines, British Airways will fly here, Virgin Atlantic will fly here. How many airlines do we have in Nigeria that can really reciprocate those services? So that's what I see as the issue here.
There's something else, of course. There is the fact that at least in the initial stages, the flights will be limited to 4 in Lagos and 4 in Abuja to see how they can process, I believe it's 1,280 passengers a day. That's 320, an assumption of 320 passengers per flight. What do you make of that in terms of the linkage between that and the viability of domestic aviation, which is said to be tied to this?
Well, in principle, you don't have to say the domestic operation is tied to this international. Yes, we need the feed from international traffic. But if you look at it, when we open the airspace for domestic flying, yes, the numbers are not so great, but gradually it's picking up. If you look at the load factor, it's picking up. Nigerians are gradually saying to themselves, it's time for us to reopen businesses, start our lives again, especially when we conform with the NCDC protocols as much as we can. But if you say we're waiting for international flights to come in before domestic flight can really be optimal, I do not really see that happening. Though it adds to it. The feed from international is good, but what percentage is it really to what is going on domestically? We have to start from somewhere, which is what this agenda is all about. But we take it a day at a time. But I don't really see it as the biggest impact on domestic travel at the moment.
The other thing I want to take you up on has to do with the impact of the protocols that are being put in place. We've seen in other countries where the whole issue of quarantining and the whole idea behind submitting tests and so on have tended to draw back passengers, especially in the initial stages and then over the long term, from flying. Do you see a situation where the protocols that are being introduced now for international aviation in country, in our own country, some of which are described as fairly stringent, could hamper patronage by passengers for international flights, especially in the short term?
It will, definitely it will. Even if it's not as stringent as this, you expect this to happen. The fear factor with the human, with us human beings is there's so much going on. Nobody's sure of anything. As much as the regulations are there, the protocols are there, there's still this fear factor. If you look at it very well, not everybody wants to jump into a plane and go to Abuja at the moment. But of course, we see that the airlines are doing their best. Federal Airports Authority and the other regulatory authorities are doing their best to ensure that these protocols are in place and they are enforced. And that way, gradually, we're moving there. But when you look at it with the international flying, in the UK, the quarantine procedure is there. In other countries in Europe is there. You must comply. But when the international airspace is opened, I expect that a few people will travel. Because you find that some of our people actually are traveling with the so-called evacuation flight. Some people are getting to go abroad and do different things. So for those who really must travel, they will travel. But it will take a while. As you know, aviation and tourism took the biggest hit from COVID-19 when you look at all the sectors of the economy. And even IATA had forecasted that the heat will remain with us for a little longer than just this year. So we're ready for it as well. And we know that for those who must travel, they will, regardless of whether these protocols are stringent or not. But it is what it is, and we just have to live with it. And we just have to make sure we comply with it.
My final question, of course, will be more general. Domestic aviation is opening. International aviation will reopen. There were talks of helping the sector out with the aid of some kind of bailout. Of course, that's falling through the cracks now because those who were supposed to do it haven't quite done it. But if it is eventually to happen, what would you say? Is it a little bit too late now? Because some of these airlines that would have been helped and some of the service providers have since dropped out of business.
I don't think it's too late. The industry practitioners, especially the airlines, the handling companies, the fuel suppliers, we all have to come together, as I'll put it, because the whole idea of I'm losing money, I'm not making money, and the rest of it is not so organized at the moment. Every operator is saying whatever it feels it needs, and the others are saying it. Probably with NCA, not so much of the ministry, the NCA as a regulator and Federal Airports Authority, because not just the airlines must benefit from this. The regulators too must benefit from whatever the government is looking at providing for aviation as it is done for other sectors. It's never too late. It's never too late. Ensuring that the right use of such resources is made is what is most important, because you can't just be throwing money at problems at all times. The industry players must get their act together, come with a strategic plan to government and sit and say, look, we don't need you to just throw cash at us. This is what we need this money to do. And at that level, it can have this impact. But if nothing comes at all, then it's bad enough. But whatever comes now should be a judicious use of it should be made.
Indeed. Thank you so very much, Mr. Larry Gbangboshe, for your time this evening. Mr. Gbangboshe is an aviation consultant, and his perspective has been quite interesting to hear. Thank you once again for joining us on the program.
Thank you, Daddy. My pleasure.
Bayelsa State Governor Doye Diri has directed civil servants from grade levels 1 to 12 to resume work by the end of August 2020. This directive is coming after 5 months of workers' stay-at-home order in the wake of COVID-19 in the state. At a meeting of the state COVID-19 task force in NWAJUBA, the governor also announced the completion of the state-owned COVID-19 testing laboratory, which is set for commissioning tomorrow.
The Bayelsa state government had on March 26, 2020, ordered workers from grade level 1 to 12 to go on an indefinite compulsory leave. This move was to decongest the offices in a bid to contain the spread of COVID-19. While reviewing the government's efforts in tackling the virus at an expanded meeting of the state COVID-19 task force in NWAJUBA, the governor asked the workers to resume work by the end of this month.
My decision is that those from grade levels 1 to 12 have to resume work. So we give them at the end of the month that they have to resume. However, head of service, it is now on you to ensure that all the protocols of COVID-19 are observed.
Bayelsa State has also recorded 20 new cases from students participating in the West African Examination Council. The affected students are said to be asymptomatic and have been isolated.
The idea was to ensure every student knew their COVID-19 status, which would enable us to separate the positive cases from the rest of the students and strive to minimize any spread of the infection. This intervention has been properly carried out with little interruption to exam activities. So far, we have tested 600 samples with 20 persons positive.
In recent times, Bayelsa State has witnessed a decline in the number of COVID-19 cases. The current figures show that there are 370 confirmed cases, 325 discharged patients, 24 active, and 21 deaths in the state.
Let's talk to Dr. Modupe Akinyenka, consultant public health physician. She joins us via Skype from the Festac area of Lagos. Good evening, Dr. Akinyenka. Welcome to the program. Dr. Akinyenka, I understand, is not with us quite yet. We'll see if we can get her back. But in the meantime, let's go outside our shores and go to South Africa, where South Africa's transport minister is expected to announce new COVID regulations related to the transport sector tomorrow. This department says this is in line with the government's pronouncement of opening up the economy and moving to level 2 lockdown. One sector holding its breath is the tourism and aviation subsector, which has been badly hit by the lockdown in the last 5 months. Channels Television spoke to the Chief Executive Officer of the Airlines Association of Southern Africa, Chris Zwegenthal, on how business in the sector has been doing under what's already allowed at this time.
Current restrictions on international travel will remain in place.
President Cyril Ramaphosa's August 15 speech shattered hopes for those in the aviation sector or those hoping to travel to or out of South Africa at this time. While local air travel has resumed without earlier restrictions under level 2 lockdown, there is cause for worry. The sector is fed by international and regional flights by about 40%. So there is still a heavy impact beyond the airline industry.
So the impact is that we're not able to bring in international passengers with foreign spend and hard currency spend, and that is obviously significant. So the sooner we can get the operation going, the better. Tourism and travel, together with aviation, contributes about 8% of the GDP.
Local air travel has seen a slow pickup, and operators admit it will take time to get the numbers back to pre-COVID figures. So for now, they're appealing to government to give incentives like reduction of user charges, payment deferrals, and loans or loan guarantees to airlines, given the situation. While South African Airways sorts its business rescue process, we also wondered how the country can benefit from outbound business when this comes.
South African Airways, as obviously they're intending to come back into the operation as soon as possible once their business rescue process is completed. But notwithstanding that, you have a lot of international airlines that fly to South Africa. And so South Africans outbound and inbound will be able to use those airlines while we await the return of South African Airways. They're obviously also within the region. A lot of our domestic airlines fly within the region to the SADC countries. So that is certainly not lost. Those airlines are all still operating. And so that can happen. So I think that from a perspective, there won't be a shortage of bringing capacity, especially when the capacity is low for initially, and that the demand will be quite low initially, but it hopefully will ramp up.
South Africa opened local aviation for business and essential travel through only 4 airports in June. More were added a bit later, and under level 2 lockdown, restrictions have been removed for local travel and tourism, provided all anti-COVID protocols are observed. And this is to boost the sector, which in regular times contributes as much as 8% to the national gross domestic product. From Johannesburg, South Africa, Betty Dibia for the COVID-19 update.
I understand now that we have Dr. Modupe Akinyenka, consultant public health physician, joining us via Skype from the First Act area. Dr. Akinyenka, it's nice to finally see you. Welcome to the program.
Thank you very much. It's nice to see you too.
Let's begin with this issue of the protocols, the pre-departure protocols for COVID-19 in terms of people who want to leave the country and people who want to come in commercially through commercial, normal, scheduled flights. What do you make of them? Do you think they're okay, too stringent, too loose? What are the opportunities here?
I think those protocols, they are not too stringent. We can't say they're too stringent. I think they would serve the purpose because we need to ensure that we're not allowing, fresh cases of COVID-19 into the country. We already have enough cases to deal with around here. So we need to ensure that we're not bringing in fresh cases. And at the same time, we also need to ensure that we're not exporting our own cases outside of the shores of Nigeria. So the protocols, they may appear to be stringent, but they're actually necessary, I believe. And so they are good.
Some of those who have been listening to a lot of this will ask the question, basically, what's the difference between a PCR test which is what the government is insisting must now happen in the wake of what has happened with those who have been evacuated from other countries back home, and the other tests that are conducted in other countries that may not be PCR based.
Okay, a PCR test. PCR, by the way, stands for polymerase chain reaction. It's a test that actually tests for the antigen. So it's checking for the presence of the virus in that person. Whereas the other test, which is the antigen antibody test, it's looking for antibodies. Now, a PCR test, the advantage that gives us is that we can categorically say at that point in time that this person has COVID if it is positive, even though they have we do have some false positives and false negatives, but at least to a large extent, we can say categorically that this person has COVID-19 if the test is positive. But for an antibody test, that's another form of the test that can be done. When this is done, all it's checking for is antibodies. So what that tells us really is that this person has been exposed to COVID-19. So we can't determine whether the person had it, like a few weeks ago, or the person currently has it. So it's not, so it doesn't give us that information. So the PCR is the test of choice to ensure that the person is COVID-19 free.
There is, again, the idea that abroad, for people coming into Nigeria from abroad, they've got to test themselves outside before they embark on the trip here. Some modifications have been made to the protocol. Once you got here, you would have to self-isolate for 14 weeks, and somewhere in between, another test would have to be conducted on you to confirm your status. Now that timing has been reduced, and according to the national coordinator, that is supported by evidence that suggests that the isolation doesn't have to be this long. Again, is this part of the changes that must be made in order to make this process possibly smoother, more comfortable?
Well, the thing with COVID-19 is that it being something that is relatively new, we are still, developing all of the data that we have and trying to use that data as much as possible to take evidence-based decisions. So I believe that their decision must have been evidence-based. And so it would be required, of course, for passengers flying in from other countries, it would be required for them to take a PCR test. And it's not just Nigeria doing this. Other countries do it as well. Before you can travel out, they would want to ensure, because the country you are going to needs to know that you are COVID-19 free. They also don't want you to come in and add to their number of cases. So it's required that you do a test that will actually test for the virus. And then, of course, the quarantine period as well, for checking once the person arrives, being sure that the person now doesn't come up with symptoms, right? So all of these things are evidence-based.
In 1 minute, I have to ask you this because so many people are asking the same question, which is that the whole issue of what happens to passengers when they are on board the plane and they are flying in terms of what they eat and what they drink and remains unresolved, or has it been resolved?
For our own local flights, I don't think they're being served any meals for now on our local flights. But on international flights, if it's a long haul flight, several hours, it wouldn't make sense to starve your passengers for long. So I believe that there would be some sort of provision for feeding on board the aircraft as well. But of course, taking into consideration all of the precautions that would be required to ensure that transmission of COVID-19 does not take place while the passenger is on board. So all of those would have to be put in place to ensure that people that have been tested and have been determined to be free of COVID-19 don't now end up catching COVID-19 while they are on a flight. So all of these things would have to be looked into to ensure that our flights are safe for everyone.
We will have to watch and see. Of course, it's still there's still some time to go before the flights resume, all the way until Saturday. We'll review again when it's much more imminent. Thank you, Dr. Akiyinka, for your time this evening, for joining us.
Thank you very much for having me on the program.
Scientists in Hong Kong University have reported the case of an apparently young, healthy patient being reinfected with COVID-19 4.5 months after he was first infected. Using genome sequencing, they discovered that the second bout, or the virus, was clearly different from the first infection, rather than just being a continuation or re-emergence of the original one. If people can catch the virus more than once, then a vaccine may be required to protect many more people, although those who are most seriously ill have a greater immune response than those with mild symptoms. Here's our global update.
South Korea has mandated residents in the capital, Seoul, to wear face masks in both indoor and outdoor public places for the first time as the country battles a surge in coronavirus cases centered in the densely populated city region. It was only back in May that the government had ordered that face masks be worn on public transport and taxis. But the latest spike in cases has officials worried that the country may need to impose its highest level of social distancing. Mexico has the third highest number of COVID-19 related deaths after the United States and Brazil. But President Andrés Manuel López Obrador says the pandemic is waning after the weekly COVID-related death toll for week 33 continued on a downward trend. The president made the announcement a day after the total death toll in the country surpassed the 60,000 mark. Spain is also mulling over restrictions on mass mobility among autonomous communities as COVID-19 surges across the country. The country had reported 386,054 confirmed COVID-19 cases on Friday, with the total fatalities reaching 28,838.
Let's talk to Johannesburg Bureau Chief Betty Dibia, who joins us via Skype from that nation's commercial capital. Good evening, Betty. Nice to see you.
Same here, Laddie. How are you?
I'm fine. Primary and secondary schools all reopened today. Before we get to the aviation matter, they all reopened today. All of them.
Well, mostly all. Some are still, phasing in because it's a bit difficult for them to handle the issue of overcrowding and social distancing, because at this point, everybody is allowed back. That's for primary and secondary. But note again, the 3-term private schools are still on holiday. They're yet to resume. That will come 1st of September. But for those who have already begun, some began school or started calling back their pupils from almost 1.5 weeks ago for some of the Model C schools who were granted deviation. But generally, everybody is allowed back in school, and many came back to school today.
Let's talk about the aviation. Just like here, there's been a big debate about what's going on in aviation circles, domestic and international. We know what's going on here. Ours is to reopen on the 29th. But over there, it seems as if they're taking a bit more time. But what kind of impact have you been told that this is having on the viability of the sector itself, which has been badly hit?
It's been badly hit, as you've said, but what we know is that the international side of it feeds the local aviation sector by as much as 40%. That's quite a lot. And with the international, if you recall the president's speech on the 15th, international flights are not allowed just yet. They're still looking at the numbers, which hopefully or gladly are going down bit by bit. Overnight, we had just 1,667 new cases. But the local aviation is allowed now for every reason, for holiday, but this is bad timing. Many people plan their holidays when their children are on holiday, but schools are just resuming, so timing is bad. So it's taking time to pick up, and international flights are not there as well to feed the local aviation industry. So they're suffering, and they're hoping that soon we'll hear a date. We expect the minister to speak tomorrow. Maybe he'll address that aspect of travel and the tourism sector, so it's being affected by all of this. So if for some reason we get a date, maybe we'll get a date tomorrow, we don't know. But the aviation sector is still not going, up to full capacity because of the situation with the aviation sector. They're doing local for work and for play, but there isn't much play because work is just starting. The economy is just being open. Hopefully, things will change probably this month or next month. Maybe we hope to get a date tomorrow. Maybe not.
All right, Betty, one more question, short answer. The stats, up or down, and what's the projection?
Very, very down. I just said it for the first time in a very long time. The new cases in a 24-hour period is just 1,667. The death toll has risen from yesterday to today by about 100. So it's standing at 13,159. Generally, the total confirmed cases is 611,450. But recovery is over 83%, so it's looking nicer. And the minister, Dr. Zweli Mkhize, who spoke this evening during a webinar, was saying we may have reached that peak or crossed the tough part. So hopefully we'll keep going down from here on.
Thank you so much, Betty, for the update. Please continue to stay safe out there.
Thank you very much. You too.
That's our package on the COVID-19 update for tonight. You can take a closer look at some of the stories and indeed the stats behind them by going to our website, channelstv.com. Business, politics, and sports can also be found there. I'm Ladi Akiri Duluale. Thanks for watching. Good night.